I'm Dr. Emily Lowthian. I'm a lecturer in education in the School of Social Sciences, but I also work across in the medical school as well. So the study that we're doing with Healthcare Research Wales, that's a study led by myself and Professor Tom Crick. We're looking at children basically kind of looking at pathways in their first 5 years of life and then also in their first 10 years of life and looking at how that impacts educational attainment at age 7 and at age 11. And then later on we'll be looking at age 16. So we can track their care experiences all the way up to age 18 to my knowledge, but in our study we're just looking at care in the first 10 years of life. So I've used the Children Looked After Dataset in my research for our collaborative Health and Care Research Wales bid. That is led by Professor Tom Crick and myself, alongside Dr. Stuart Bedson, Dr. Alex Lee, Dr. Lucy Griffiths, Dr. Donald Forrester, and also Ashley Akraby. So it's a kind of multi-team, different sector approach to looked after children. So with that data set specifically, we were able to link it to demographic data, so neighbourhood deprivation, gender, birth cohort timing. We were also able to link it to mental health. And one of the benefits of using that data set was working with Dr. Stuart Bedson and Dr. Alex Lee, because they were able to boost the sample size, so it was a lot larger. We're able to use it in lots of different ways, collect very intricate data, which is still anonymised and still very safe to use, about those children. So kind of how long have they spent time in kinship care, for example, so with siblings or relatives? How long have they spent time in foster care, or were they adopted? So we're able to kind of collect a lot of different data to look at how children move through care over time. So we started looking at how children move through care in their first 5 years of life, then also their first 10 years of life, and linked that to educational attainment. The benefits of linking the Children Looked After datasets with other sources are particularly that the dataset on its own is very useful for kind of intricate, detailed information on those children, but actually without the linkage, we're really limited in what we can do. So this ability to link to demographic data, so inequality, deprivation, birth cohort timing, gender, that allows us to pick up a lot more information and a lot more ability to do really good research, because the more factors that we can control for in research, the more we actually understand how much being in care affects children's outcomes. Additionally, being able to connect to the education database has been really important, because we can look at educational outcomes for children in care, which obviously is an important predictor of life opportunities and future social mobility. But outside of that, we're also able to look at special educational needs. So for example, diagnosis of autism or ADHD. We're also able to look at mental health through GP records. So, you know, the ability to link to other datasets is really important, and it allows us for much more detailed research to be able to be conducted, much more robust research. And obviously that feeds into policy and practice, meaning that the decisions that we're making are the right decisions that will be there to support children in care and the service providers. Yes, I think the availability of research-ready datasets is highly important for researchers. So for example, before I came into data science, I worked as kind of more of a social science researcher. I was used to a lot of cohort data, which was cleaned, easily kind of prepared, with lots of documentation on how to use it. And that's great, and that's what we're used to as social scientists, but actually moving more into the data science field and using kind of administrative data sets, that ready-to-use aspect is really important, because it allows more availability for a wider range of researchers to use that data. In order to use kind of very complex, messy administrative data, you need high data science skills. That takes a long time, and also sometimes isn't in the remit of everybody to be able to do. So having that kind of ready-made research data set to go allows us to move faster with our data, with our research. It allows us to kind of publish those findings quicker, and that leads to faster policy and practice. It also allows for kind of more, I think, robust and correct research, because we know those data are clean, we know that they're ready to use, and we're not worried about making mistakes with that data. You know, when we're learning how to kind of use complex skills, there's less room for human error when that data's already clean and ready.